You're listening to Community Level, a podcast where public health research meets real-world impact. Brought to you by the Community Health Sciences Division of the University of Illinois Chicago School of Public Health. We bring you real conversations with researchers, practitioners, community leaders, and organizations working to create healthier communities. Now, let's dive into today's episode. Hi everyone, I'm Kaija.
I'm Caesar.
And we collaborated to put this episode together on the expansiveness of public health. And so I'm going to pass it to Caesar and they will talk a bit more about what's to come.
Today's episode, East to West, is a three-part exploration of how health studies are shaped and changed by the choice of lens, whether it be from the humanities, the social sciences, or a blending of the two. Each conversation is followed by a short break, so feel free to take your time enjoying this special extended edition of the Community Level podcast.
In these three conversations, you'll hear voices from the fields of anthropology, Black studies, social work, history, and gender and women's studies. So we've got a lot of good information packed into this episode. We hope you enjoy, and thanks for listening.
My name is Caesar, and I am here with Dr. Mario LaMothe. And if you would mind sharing just a little bit about your positionality and so people can understand a little bit where you're coming from.
Sure. Yes, my name is Dr. Mario LaMothe, LaMothe in French or Haitian Creole. I'm of Haitian descent, born in the U.S., and grew up between Port-au-Prince, Haiti, Brooklyn, New York, Boston, Massachusetts, and here I am in Chicago. I am an assistant professor of Black Studies and Anthropology at UIC, where I focus on the arts and expressive cultures of Black folks, people of African descent, especially in Haiti and the Caribbean. And Haiti is you might call it my research site, but it's my home also. I also, as part of that sort of those studies of arts and expressive cultures, I specialize in Vodou culture, Vodou spaces as spaces of empowerment for populations who are marginalized, especially queer populations. And so as part of that, because in Haiti, when I was doing research, I began to do research not only with Vodou practitioners, but also with queer folks, where, to go back to your point, I hadn't earned my PhD yet, but I was doing my PhD in performance studies at Northwestern University, where I focused on Black cultures, performances, gender and sexuality, and how to do collaborative research, decolonial, sort of empowering collaborative research between all interlocutors. And the point, so when I began to do research so in Haiti, when I began to work with queer populations, I got a job. Um, and not nobody wanted Haiti, but it was a job creating an education program for LGBTQ folks designed by a queer person like myself for the population with the constituents. And so that's how I fell into sort of a public health arena, at least in Haiti. Anything related to sort of gender and sexuality, it seems to be taken care of by public health medium.
I wanted to talk about the ways in which your public health work and your work as in performance and having taken your Black Studies class, which was really powerful for me as someone who really was tempted by Black Studies, but kind of got sucked into public health in my studies. Um, I was wondering, what do you think public health can do to kind of better get their stories out in the world? Because when I saw the exhibit at the Black Cultural Center of your work, which was about contagion and just was about rooted in us, just rooted in Black folks, Black queer folks, as well as also a Black queer person, I guess I could have come up with earlier. I want to know what you think public health can do to better engage with people and get these stories out, because we struggle a lot with dissemination, and it's all about papers, and it's very little of it is about actually reaching the public with our outputs.
Mhm. Thank you. That's a beautiful question. I would say that, well, okay, being trained in performance studies, which it's a very interdisciplinary field that definitely wants to look at how we work with, think with, and the word with is very, very important, with in collaboration, in facilitation with human cultures, but really populations who also need a platform, or like we can help create space with them to speak about their lives, right? It's basically, it's really, it means it's a field that means to be very collaborative. And it's a field that also thinks that if we're speaking about decolonizing spaces, we also need to not only write that way and show it that way. Everything we do, because it's a practice, right? In performance, the idea of performance is like things are repeated and repeated over time, and they become normalized. Like our, a boy who's
Mm,
born with like a penis, a male body who's born with a penis becomes a boy. That's something that's repeated and stylized. So there's a way that performance study would say like do what you also in your writing, in your practices, in your collaborations, do what you preach. So it goes back to Haiti. So when I was hired to do, it was a job with PSI Haiti. PSI is there's a it's a US based health entity. It's based in DC. Something public PSI, something public service, or something service international. But in Haiti, the branch was, we had several programs, HIV, HIV AIDS, mothers and children, and sort of other health concerns for other populations. So my job, nobody wanted it because in Haiti, homophobia and transphobia is, it's not punishable by law, but it's very pervasive. Nobody
mm,
wanted the job because folks didn't want to be attached with a sort of like a gay or a queer project. So they didn't. And here I came, I was, born, I speak Creole and French and English really well, sort of grew between all those cultures. And so I needed a job because I didn't want to return to Chicago. I was in Haiti
mm,
already. Chicago was like, let me stay in Haiti and finish my research. So I got a job to like take care of like create an entire education program for queer populations because in Haiti they're considered the most at risk for HIV/AIDS. So the population was already over-researched. Like people, like
mm,
some countries, people with HIV, especially queer, like male bodies, they've been pricked and spoke and talked about, and So I inherited a population that was fed up with like it's the same stuff. People come with their project, plop them onto us, and we do them. So my first session with my folks, I remember like my first, and it was a peer education program. Like I would train super people to go out in their communities to train other people to train other people, like a peer sort of like that kind of project. And so they were like, no, can you give us a space to create the program? I'm like, okay, so how would the program run? And so people decided like, yeah, okay, we know I think somebody said, we know the US, it was funded by USAID. It's like, we know USAID wants certain things. So yeah, we can, in an hour doesn't have to be a full hour of like, wear a condom, do this, do that, but maybe we can have 20 minutes to just talk about what's happening with our day today.
mm,
So they created the system, they created the program. So this is where performance and sort of public health, basically people created the program. We created a board game. It was really based on research with the population about what they wanted to see, how they wanted to interact, how to be educated about their sexuality and their health. Um, Without being, the target of sort of violence. So there was a way like, how do we do, like, can three queer men sit together and just talk? And if somebody comes by, they don't see like, they don't see things that they would perceive to be gay or queer, and it's to attack them. So the entire program
mm,
was created with their, like in collaboration with them, as opposed to me coming in as an expert to say, I know performance and performance studies encourages, and like being an ethnographer and from the realm of anthropology, thinking that you are my collaborators are the meaning makers and the knowledge producers. How can I help you put this in the world in a way that I know will be very effective for your populations? And so it's part of that experience that I created like the exhibit. So as I was doing that research, I got a I finished my dissertation, got jobs, and I got a postdoctoral fellowship at UIC at the Black Cultural Center. And the director then, Dr. Lori Baptista, wanted to like she had some funds, some money, and she wanted to create like, something that could travel around campus that was about Black cultures. We don't talk about health, we don't exhibit culture, and we not much like, the center of exhibitions are not about, not about sort of medical stuff and health stuff. But there's a way that when I was speaking with Dr. Baptista about like what I learned, I said, I'm not a health specialist, but what I learned in Haiti, like this is, I explained to her all I've learned and all of the threads of that knowledge. And she thought that it would be something that we could show at UIC, especially to think like, how as Black folks themselves taken care of ownership of their own health, the same way that my
Hmm.
interlocutors in Haiti, that like, how do they say, yeah, there's a system, there's an oppressive system, we know what it does, but how do we say, let's create a provident hospital for ourselves, by ourselves, for us, by us, like my Haitian interlocutor. So that's what the thing what we try to do with the exhibit. But also understanding that these things, like when we think about health, especially for people, like all of us as human beings, but certainly people of African descent, if there's a way that our concerns are all interconnected, or if they're not, the system people look at them as interconnected. All Black people
Hmm.
have HIV/AIDS wherever they are in the world. So let's just target them every, like it's so not only the reality of people being interconnected, but also the perceptions of that. But also like Black bodies as sort of always seen as pathological, as disease, as needing health, or needing certain types of intervention, you know, that's imposed upon them as opposed to them saying, no, I know, yeah, I need things to work with me, but I need my space for my mental health. I need space for something else.
Yes.
So that's that's a long that's a long sort of explanation, but that's how performance and sort of public health work for me. And moving forward, I do want to like figure out a way to synthesize them more. But I think in spaces like Haiti, number one, like nobody like there's a way that the programs that I was made to create was like, oh, let's make them sit and like, like sort of the very Socratic, like I'm gonna sit in front of you, I'm gonna say do this, and we're gonna repeat. And I said, no, we're not doing rote memorization. They can, they queer folks will like Haiti, they know the spaces that they feel safe. They're going to do it. They're going to have their own system of
Yes.
communication to get to the place. If they want to sit on the floor, and they'll sit however they want to sit to be comfortable and to. So there's a way that to funders like USAID that I work with, there was like a German funder, KfW, in the Caribbean, we have to say, we're not going to copy paste the programs you've already implemented. I think in Haiti, people need something else because they're oversaturated with like education projects and health projects.
I really appreciate that answer, and feel free to go as long-winded as you feel because that's what we're here for. We're here to
All right.
get the story, and that was incredible. And you mentioned so many important, I feel like, touchstones that I wanted to come back to, like USAID has been completely decimated by the current administration for good or ill. There are a lot of critics of USAID, but it's estimated that maybe 600,000 people may have already basically been, lost life-saving aid through the destruction of USAID.
Mm,
And I feel like I just can't not bring that up, in this context, when it will be a few months before people hear this episode, most likely, but who knows what we'll know then about what's happening now. And also, when you talked about creating the board game and the way your work was conducted, it reminded me of the work that I do in public health. We do what we call community-based participatory research, which is very similar to what you were
mhm,
describing. Like, and this is in, would you say your work is applied anthropology? So
mhm.
that's just the way you do it, your work. That's your method, and I love it. That's incredible. That's the only type of research that I've really been interested in, and the only type I've really done so far, and it's where I really see my future. And so it's really incredible whenever I hear stories about how that work has been conducted because it's just so natural. I feel like in anthropology and in public health, this is not the standard by any stretch. This is very much like the fringe, you might almost say, although I think it's becoming a little more popular.
Yeah.
And I am part of a project that created a board game that did work in what we call Greater Lawndale, which is North Lawndale and Little Village in Chicago. And they created a Loteria game that people can play, and you learn about the roles that people play in the community and the landmarks.
Mhm.
And as you said, it was created with, our interlocutors are equal partners in this work. It's not about us coming in with the question, right? It's figuring out what works for people.
Mhm.
And you also reminded me of a new framework that I've read about recently called the cultural determinants of health. So you may be aware that the social determinants of health is like the huge pillar of international public health work everywhere. But
Mhm.
the cultural determinants of health is relatively newer, and it's a strength-based framework that is rooted in really trying to kind of, you could say, combat the our cultural our social determinants of health methods often see people's cultural behaviors as risks, as things that harm them, as things that
Mhm.
are negative in some way. And so this is instead looking at the culture of people as the thing that's actually been keeping them alive for thousands of years and that has a
Yeah.
lot of value, right? And it's strength based, and it's designed to work in concert with the way people's culture was. And this has been used to great effect for what I guess if you want to combine the groups you would call Aboriginal Australians, like like Torres Strait Islanders and Aboriginal folks in Australia who have many incredible cultural touchstones that have, I feel like people in the US and people in the West know about maybe through movies more than anything else. But uh, this work has shown through an incredibly powerful longitudinal study they've done over there to have incredibly good health impacts for people to actually include their culture in their work and to help people get engaged with ways that their culture overlaps with like modern employment roles, like of whether it's having Aboriginal people who have a deep connection to the land actually work with the government to steward the land and to protect the land, and how this has just been so good for people. And so I'm hopeful that we can do more things like that here in public health. And I think part of that is going to be through building connections with people in anthropology and in other fields and history and gender and women's studies. And yeah, it was just that was so much you gave me that I just wanted to kind of reflect back and what it made where it made my mind go. Um Also, I guess I wanted to talk about if you've experienced what it's like to have work that kind of has that long tail. The exhibit at the Black Culture Center was a traveling exhibit, right? That's also kind of unusual in public health, I feel. And so this was also something that Dr. Brier did that we spoke about in a previous interview of, currently Dr. Brier has, most recently went to a funeral for one of the people that was involved in this incredibly long study. And these are people that she has known for decades. And this is highly unusual in a public health context to, unless you're part of usually what's a long term, like a very biomedical, healthcare based study. And even then, you usually have so much detachment from the people that you work with, right? And this was not work that you created in concert with them. But in the case of a Living Women's History of HIV, they were so deeply involved in this work. And so, what is it like to see your work just keep going and be out there and remain connected to it if you have been able to, over time, as opposed to just, having a project and then kind of jumping from project to project, and as academia often wants us to do?
Thank you. Thank you for the question. I, I think the way I think about my passions, like the subject or the topics I explore, is that, the topic I don't know, it's sort of like the topic is it's a trunk, and then like everything else branches or leaves and sort of
Hmm.
so I my interest, you know, they're all one and the same in a lot of ways because I began to study, yes, my book that's coming out soon is about
Oh,
how
please tell us about this book. I need to know about
we,
this book.
we can come back because it's really so I think what I want to say is that like the work I did for like like sort of bringing like doing like an information education and sort of communication program with queer Haitians, it feels like it's an offshoot of my the what I began to do. Like I went to Haiti to study voodoo aesthetics, dances, songs, and how contemporary folks, artists use them in their artwork. Um, but the branch with like the queer population led to like doing a lot of public health work. I had to get trained really fast. I had to travel to Washington to USAID to be trained for like a month here and there, and just to do, just to understand how, community-based education works. As opposed to me like teaching in my fancy class at Northwestern, which is all I knew. Um, but so for me, it's all a continuation. But I think it's only it's I've always I but it's a continuation and a theme. It's an exploration. It's going deeper into these spaces and not those spaces. A choreography of Contagion inevitably like focus on a larger conceptual idea I have is that not only are Haitian people deem voodoo and voodoo in not in the least affirming sense, in sort of the fantastical sort of American supremacist, like phobic way, but like but like there's like the Haitians are considered voodoo in the way does that way, but also Black people in general are considered voodoo in that way. And so I think like that's the overall theme, and that's how I made connections, not only like sort of a Black Chicagoans who took health matters into their own hands, creating one of the first like major, not no, no, Black national hospitals, but also opening up to like, hey, here are some of the ways in which like Black people have been experimented upon. So there's a way that they've always like, yeah, we think Haitians or people in the Caribbean are voodoo, but like it's an idea that's applied to all of us if we're of African descent in one way, shape, or form or another. So that's where, like, to go to a question, that to me it's a continuation, but it's also a continuation in various like mediums. I I I'll say it and I'll say it again. Right now I have to write like statements about like, being, for going for tenure, I have to write about like research statements, and I never I did a PhD. I think I did I wanted to be in the community. I did like I thought after grad school I would go into Haiti and open like a creative cultural center. Like I didn't see myself in academia at all. I thought I was going to do the kind of work I was able to do for a few, like 4 or 5 years in Haiti with the queer Haitians. So, but I also feel like there's a need to that I so now being in academia, I have to sort of show everything by text. I have to publish. Um, and I think publications sort of, however beautiful they are, they stay confined to certain people who are
Hmm.
reading them. And, typically like I write for my peers and my peers read them. If we're very lucky, we publish a piece that undergrads can read, but it doesn't go beyond those spaces. So I've always felt like, based on my work in Haiti, we needed to share knowledge in different forms. It's not only like text based. For example, one of the I call an exhibit myself. One of the first exhibits I think we did as a group in my training program, like the very first one I did in February in March 2011. So I remember like we did a lot of, like how you in like those health sessions, you do a lot of work on sheet of paper, you do exercises, you draw. We had a week long worth of stuff, that we drew. They did like paperwork. We did a lot of activities. And so what I said, like the final, like, the reception or like the closing event, like they can invite their friends and family, was I'm like, okay, you're going to curate. Like, here is everything you learned this week. So basically I helped them mount all those sheets of paper to make like sections about the weeks. So I did they did their own exhibit. It just costed 2 hours of our lives with like tapes, and we hand wrote. Like it was beautiful. Like it was the first time I did an exhibit. Like literally, and I'm like, oh, this is when we did it together in a couple of hours. We did music, so they devised it. So I think that's worked for me. I like to share my knowledge, whatever I produce or help people produce, in sort of not only textual forms, but like an art exhibit. Right now, I'm working on a website. I'm like, well, maybe there are ways that we can create like information could be on a website that people can use on their mobile phone. Um, and not only like sort of information about their health, but like any sort of like anything they'd like to read about their humanity, anything that relates to their overall humanity. And I think that's where like this is another thing that I learned about health. That it's not only like it's also that my mental health, my overall environmental health, my everything around me That's how I need to think about my health. So I rambled, but I hope I
No,
made some
I
connection.
appreciate that because again, you everything you were touching upon was really spinning my mind off in different directions again and really painting a picture for me and for the listeners who will hopefully appreciate this episode. I do want to uplift what you said about humanity. I think that's really what it comes down to is again working with people and not on them and having their humanity be at the top of mind. And when we did the photo voice with the street vendors in Little Village last year, again, we were racing against the election and we had an exhibition and people invited their families and we did the thing. We had the poster boards, we had the room, we had food, music, and we had community and it was so beautiful. And it really solidified for me, I think, that it's incredible that you can do this with research. And I think more people should know that that's what you can do with research. Again, it doesn't have to be just that paper. You're going to have to write that paper, especially if you're trying to get a career in academia. Don't let me confuse you on that. But you can go beyond that, and your work can live on, and your relationships with these people can also live on. And, it's not about this the clinical distance that is often taught for certain types of research is important, but it doesn't have to be all research and it doesn't have to sand off these connections that we have to our community. And that's why, here that's why I'm a student in community health sciences because this is the type of work I want to do. And I'm really thankful that you were able to speak with me today so we could talk about this so people could understand that whether or not they stay in public health, whether or not they are tempted like me to do a PhD in, wherever, that you can keep doing health focused work. You can do it in community with people and it doesn't have to follow the rules, so to speak, of like what you know, you were maybe taught about what you think research is when you think back, whether it's to horrible, you know, touchstone events like Tuskegee or things like, the Framingham Heart study that we're always talking about, this, the super long longitudinal study that's helped us and doctors learn so much about the health of individuals and this, it's good work. Um, that study, but it has a lot of limitations because it is in its way it is its own it is its own limiting factor in just the design of it. And so I want people to realize, and I think you've done a lot in this interview to help them understand that they don't have to have those limitations and they can dream bigger than the work that they learned on that maybe brought them into this, that made them a scientist. And before we end the interview, I want you to tell me about this book because I didn't know you had a book coming. I'm fascinated to hear about it. And whatever you'd like to share, please do. And yeah, and then we can wrap up.
Yeah, so the it's you can say like it's my dissertation to book, my tenure book, whatever you want to call it. It's called Vodou Rich, Haiti Dance Makers and des Doublage. And the book essentially focuses on what happens when Haitian dance makers, choreographers, well known, like I took four like the cases of four well-known choreographers, and what happens when they travel abroad and when they travel abroad like what they like in the natural or sometimes sort of um um or like not forced, but they're when they travel abroad, they become cultural ambassadors of Haiti. So what happens as cultural ambassadors of Haiti? How do they program their pieces to sort of combat ideas of Haiti, primarily voodoo fantasies, especially American? So I look at like those four dance makers from different styles who like themselves, two of them are Vodou practitioners, two of them are Vodou sort of they understand it, they researched it, and what are they trying to communicate on stage to foreign audiences, especially those who think they know about Haiti but they don't. So like that's sort of like a space of like, hey, it's entertainment, but it's also education. So, but also the stakes of being cultural ambassadors themselves, et cetera, art funding in Haiti. And I look, I touch upon gender and sexuality. I talk about, there's a way I talk about environment, sort of, all those cultural factors. You say like, like cultural determinants of health, all those cultural factors and how they impact the wellness and livelihood of sort of Haitian dance makers as cultural ambassadors. So that's what the book is
Wow.
about. It's
Wow. I'm
a
really
dissertation
excited.
book. And it's also like all those doubling, those multiple consciousness that some of us in the world are always we live with them. So, people like multiple consciousness, like, oh, it's a thing. I'm like, some people just not naturally sort of are flipping through scripts all the time
Mm.
as the world has put them in that space. And so Haitians are naturally like they're always in multiplicity and like having to like juggle all those sort of ideas when they travel.
Oh, I'm so excited to read that. I truly am. As someone who practices capoeira and who learned about things like candomblé in your course and learned about so many incredible performers, I'm really excited to check that out. I think hopefully our listeners will also check that out and learn a little bit more about the wider world because again, it's just there's such richness, I think, in Black culture and I'm really thankful again that I was able to speak to you today and talk about this and I just wish you the best luck with this book. I hope it goes wide. As you were saying, it's tough. I feel like in academia, we often feel like we have smaller audiences. We often feel like we're speaking mostly to our peers, but there's such richness in our work, and especially when you do the work the way you do, where you're including the humanity of people in it. And so I hope it goes wide. And yeah, is there anything else you'd like to say to the people before we wrap up the interview? Again, really thankful for your time.
No, I have lots to say, but I look forward to another conversation. Thank you so much for your question, for your attention to details, for for like, and really sort of teaching me too. Like I've learned quite a few things today, and I look forward to picking your brain about other things for sure. Like I'm really interested in the idea of like the cultural determinants of health and what that means. Thank you so much. You've been really
Excellent.
attentive and great.
Thank you so much. Thank you so much.
Bye.
So, we just heard part one of today's episode, where Caesar spoke with Dr. LaMothe about how public health intertwines with his work in Black studies and anthropology. Now, before moving forward, we're going to take a little break, so feel free to pause, take a moment to digest what was said, and when we return, we'll be joined by Dr. Mangum, where she and I will discuss the intersections of public health with social work. Welcome, everyone. Thank you so much for tuning in. We are lucky enough to be joined today by UIC's very own Dr. Laurenia Mangum, who is an assistant professor in the UIC Jane Addams College of Social Work with an MSW, MPH, and PhD. Come on. We are going to be talking to Dr. Mangum today about the interconnections between public health and social work and a bit about what that looks like in practice, whether that be on our campus or out in our communities. Dr. Mangum, thank you so much for taking the time to be here.
Absolutely. It's a pleasure to be here with you and involved in this important conversation that we're going to have.
Yeah, we really appreciate having you. But, just for starting us off, as a dual degree student myself, I am very excited to have this conversation with you as I'm involved in both public health and social work. And I would love, if you've seen in the movies how sometimes the main character will start at, this point in the thick of the action and they'll be like, you're probably wondering how I got here, and then they kind of work backwards to see all the moments that led to that big climax. So I would love to do that with you right now, and if you could, I know I gave you a bit of an introduction already, but if you could talk a little bit about yourself in your own words for our listeners, and then we can work backwards from there and kind of see what brought you to this point.
Yeah, sure. So I am Dr. Laurenia Mangum. I am an assistant professor in Jane Addams College of Social Work here at UIC in my third year tenure track position. Whoop, whoop, whoop. Yeah. I consider myself a public health social worker, but also a social behavioral scientist, having my PhD in social work education, not social education, but social work. My research interests are sexual and reproductive health inequities among Black women. Many of my research projects look at HIV across the continuum. So looking at those people without an HIV diagnosis, how can we have them engage in behaviors to ensure that they don't acquire HIV? So looking at the use of medication, so HIV pre-exposure prophylaxis use among Black women, and then among people living with HIV. So particularly I work with women and children, so mothers living with HIV, thinking about how we can create interventions to help them take their medications and are adherent to their medications just for the betterment of quality of life for themselves and their families. So looking at antiretroviral treatment adherence among Black women living with HIV. So that's more broadly my research areas that I focus on that kind of marry together public health and social work. How did I get here? That's a great question, because I didn't imagine Laurenia being where I am in this particular capacity. I would have to say early on, my earliest memories of just public health social work were just being at home in New York City, because I'm from New York, and watching a show on, I think it's TLC. It was about babies being born to mothers who were substance exposed. And I remember, I want to be like an OBGYN. But when I was in high school, I did face some biases from professors. Like when I expressed wanting to be a physician, they would say, well, you have to go to school for 4 years, and then you have med school, and then you have residency. Why don't you think about other options? So I said, okay. I remember when I was just watching that documentary, seeing a social worker. So I said, well, maybe if I can't be an OBGYN, I can be a social worker. So that kind of started that path with social work, where I had a clinical focus in working with children and families, of course. Then I earned my MSW from VCU. And then I also minored in Spanish. So also thinking about your path is not linear, right? It's kind of wheels and pivots and what have you. And so because I was interested in Spanish, I wanted to do teaching as a second language abroad. Once I graduated my MSW, I met a colleague during my internship, and she said, hey, have you thought about Peace Corps? And I said, no, I never heard about Peace Corps. What is it? And she said, well, you'll have the opportunity to live abroad, to live with another community, and provide help to them in whichever capacity that you are qualified and trained. And then once you return from Peace Corps, you can get a government job, and you'll get loan forgiveness and what have you. So I said, okay, that sounds like a great opportunity. Fast forward, I was placed in the Philippines, which is Southeast Asia, archipelago out in the ocean, and worked with women and children in the areas of HIV prevention, maternal child health, and just reading literacy. And then in those capacities, I had the experience using my MSW to put forth programming that would benefit children and women who were survivors of sex trafficking and impunity in the Philippines, and really giving them the skills they need to thrive. And also worked with babies, right, that were neglected, surrendered, and getting them ready for inter-country adoption as well as local foster care. So as you can see in both of those roles, really focusing on public health and social work. And so it's customary for Peace Corps volunteers to come back to the States after we finish our service to advance our education. So I said, you know what, let me get this certificate in public health. I was already doing public health work. And then I received mentorship during that certificate program. One of my professors said, hey, Laurenia, have you thought about doing a PhD? I said, I don't know about that, maybe. And so he, was essentially became my sponsor and wrote letters of recommendation. And I started my prep research with him through class assignments. Hint, hint, those class assignments can take you places. Mm-hmm. And then the rest is history. So I applied to PhD programs in public health. The only one that I didn't apply to, which wasn't public health focused, was University of Pittsburgh School of Social Work. So I got but had a combined program. And so I was accepted into all the public health programs, but I chose social work because it offered the most funding and support there. So yeah, that after I left Pittsburgh, here I am in Chicago. So yeah.
Yeah, no, thank you for taking us on that, journey.
Sure.
Here. And, I really appreciate how you said that, the pathway is not linear, because it sounds like you've definitely, you've been in a lot of different countries even, mm-hmm. and you've had a lot of different influences, whether that be the media, professors, friends,
right.
All of that influencing you and bringing you to this point. So,
mm-hmm.
yeah, thank you for that.
Sure, absolutely.
So do you feel like you've had opportunities to collaborate with public health projects on campus at all? And, if yes, maybe you could talk about what that's looked like so far.
Mm-hmm. Yeah, I think so many of my collaborators are actually out of social work since I focus on like HIV prevention and HIV treatment and care. I have had the opportunity to collaborate with people colleagues in the College of Nursing, really, again, thinking about PrEP use among Black women. So offering some insights, serving on community advisory boards, so community research advisory boards, but also providing collaboration with doing projects looking at interventions to increase PrEP use among Black women. So in that regard, I've been like a collaborator with them on their projects. But I am also working on my own project with people in the School of Medicine, and also here in public health, actually, really looking at developing an intervention for, again, moms living with HIV, where it does combine home visiting and also mental health services with also other components that would reduce the burden of coming into a clinic or another site to receive care. So we're looking at something that's more comprehensive and that is patient-centered, so that we're looking to get that off of the ground with submitting a grant to the NIH relatively soon. But again, the government is shut down, so that does also impact us submitting grants, receiving feedback, and those type of things. So when we think about the government shutdown, it really is starting to impact every facet of our lives. We also heard about, flights that are going to be canceled, and we don't think about that too. So yeah.
Yeah, no, it sounds like you have your hands definitely in quite a few projects happening. That,
for sure.
Combines both the social work, the person-centered, patient-centered, with the more public health perspective.
Yeah.
But going off of what you were just talking about, with the government shutdown and funding and all the different ways that, we're affected right now, I would love to hear more, because there's so much going on. AI is growing, climate change is happening, funding for things like your projects. How do you feel like these shifts are affecting both social work and public health? I know you touched on it a tad, but I would love if you could expand on that.
Yeah, I think when we think about, so I guess we can start with AI and thinking about the impacts for public health and social work. I think with AI, we see the potential and possibility to fill the gaps where we may be limited with just human workforce and just training in different areas. We see the inclusion like in medical fields where you may have certain software that can, or we can use algorithms that can detect certain diseases or put in place certain interventions or behavioral plans that has us worlds ahead in time. When we think about, just thinking about social work and treatment planning, we also can use that development or this additional insight. Whereas if you are at an agency that is resource limited or has a shoestring budget, you may not have that capacity. But with AI, it definitely can step in and buffer in those situations. But we also have to think about the environmental impacts of using AI and thinking about the data centers that house that the software and just the mechanisms, and how that pulls on a lot of water use and how that is impacting low and middle income countries and that workforce. So thinking about it from that perspective, but also thinking about the ways in which with public health, we're looking at population health and how we're seeking to improve the health for all people, right, at the granular level. And with social work, we can say, hey, I'm looking at this family and we have these complex needs. And so we really need to think about how we bridge that gap. So one example would be, we know from environmental perspective, people who live on streets with less trees, they have higher cooling bills and things like that, and they have different outcomes. And if we think about just breaking it down at a zip code level, we have different health outcomes. And when we think about, I'm losing my word here.
Life expectancy?
Yes.
Okay.
Yeah, so we know, I'm sorry. So we know from just from a research perspective that our zip codes can tell us one's life expectancy. One resource you can think about is just the Robert Wood Johnson Foundation County Health Rankings. And if you look at that, it breaks down the health outcomes for like a county, right? So you can see like the richest, wealthiest county and those outcomes and how many mental health specialists are available, how many doctors versus those that don't have as many. And then you can think about the racial, ethnic demographics and which communities are more heavily burdened by lack of resources, higher pollution, lack of schools and funding, and how those all intertwine and impact health. So it's really important to really think about just the integration of the professions and how we can work together to alleviate some of those social problems that are most pressing.
Yeah. I think you really, called attention to how a lot of these new innovations are kind of a double-edged sword, because there's the convenience aspect.
Exactly.
Of, maybe helping things to get done quicker, but, what are the implications of that, on the community level, on the ground level of the environment. So, I think those are big topics and very loaded, but
right, exactly. Because I think what's at the heart of what we're discussing is just equity and resources and equity, like sweat equity. So for example, if I don't have a TA, I have more of a burden on me to do the work as a Black woman versus someone who's at a different university who may have more resources to do that work. So then I have to supplement that with what resources I have available, right, to put me ahead. And so it's when you think about how these systems can help like level the field, but we also have to think about long-term impact. Yeah, so it is tricky. And if we just dismantled like racism and paid more attention to the structural things impacting our world, we wouldn't have to like sacrifice in other ways. Yeah.
And just like you said, like who does that burden fall on too? When you're using these kinds of tools.
Yeah.
Like when you who's the ones that feel like they have to use these tools also.
Yeah.
And I think just kind of pushing towards the end here, starting to wrap us up just a tad. I was curious to know a little bit more about where you see opportunities for these two fields to come together. You definitely have touched on it, but if there's any more specific ways you've thought about to kind of help work within this climate that these fields could collaborate that maybe you want to see more of.
Yeah, I think again, so with public health, it's really good at telling the stories. If we're thinking about just population health, thinking about like, let's just, since I talk about disease prevention, thinking about the cases, like how many people are impacted. They're very good at giving us that level and telling us, hey, if we don't have these interventions in place, these health outcomes will arise as a result of that. But with social work, I think we have that focus on social justice and advocacy. So where we have public health focusing on the public's health or just population health, we have the real opportunity to integrate that social justice into it and advocate and meet with our public officials or elected officials to really drive home the points of the data and the mechanisms so we can do the hard work, right? So public health more so has like the head work at time. And so we help to just mesh both of that so that we can really feel that impact, which may be missing sometimes. So really thinking about more holistically and comprehensively meeting the needs of people. And we can't do one without the other.
Yeah, and I want to emphasize, I love what you said about, public health kind of being the head work and social work being more of the heart work. And, they can kind of, one can pick up where the other one might leave off.
Yeah.
Come together and, create this whole picture.
Absolutely. Yeah.
I really like that.
Thank you.
So I think, final question, wrapping things up. Or maybe final two.
Okay.
Maybe we'll combine these because I would love to know what advice you have for someone considering a career, at the intersection of these two areas. But then I also do want, to talk about, looking ahead, what gives you hope, maybe end on a high note because we talked about some
for sure.
Things. So I don't know if there's a way to combine those two or answer those separately.
Yeah, I think if you're exploring a career in public health social work, don't do the work alone. So don't work in silos. So with social work in public health, make sure you get a mentor. Don't be afraid to reach out to people and say, hey, I love the work you're doing. I've been thinking about it from this angle, or would you mentor me? Can I work on a paper with you? Is there some research where I can lend my skills? I think that would be helpful, and, we'll take you in, and it'll be a beautiful process after that. And getting a link into the work, right? So there's a lot of grassroots work happening, a lot of organizations doing this important work. And you want to be dialed in to know what's happening at the ground level, because sometimes there can be a disconnect between academia and what we're doing, and then what's happening at the ground level. So you want to make sure that you keep your ears to the ground.
Yeah, that's good advice. I'm actually mentally taking notes for myself as we speak.
Yeah.
So thank you for that. And
Sure.
anything that gives you hope about the future? Anything else?
I think what gives me hope is that the younger generations are more vocal and stepping outside and drawing outside the lines from where we have traditionally taken our message for doing advocacy work, or how we can address systems for change and how we think about complex problems. And I really appreciate that, because it's refreshing to know that, one, our work is not going in vain, but also there are many ways to think about these problems. So I think just the collectivism and not the individualistic thinking that we're seeing many times in other areas of the world, right? So how we're coming together, that motivates me right now and gives me hope.
Yeah, absolutely. It's always very empowering and invigorating to see the way that people come together, especially when times are tough.
Exactly.
So,
Absolutely.
Well, I appreciate this so much. Yeah,
Sure.
thank you.
It's been my
Thank you
pleasure.
I hope you enjoyed Kaija's conversation with Dr. Mangum and have a better grasp of how social work and public health complement one another. Up next, I sat down with Dr. Jennifer Brier, a distinguished professor in history and gender and women's studies, right here at UIC. Together, we've explored how important shared authority and deep listening are to collaborative health and humanities work. From I'm Still Surviving, a living women's history of HIV, to Listening for the Long Haul, a long COVID oral history project. Settle in with us as we uplift the importance of the public in both history and health. I am here with Dr. Jennifer Brier. Would you like to tell us just a little bit about yourself?
Well, I am on the faculty at UIC in Gender, Women's Studies, and History, and I think I might be in my 22nd year here. Was my first tenure track job after getting my PhD in history at Rutgers. I worked for a year as a teaching faculty member at Rutgers. That was in the fall of 2001 in New York City, so we know what happened then. And then I did a year at Hunter College, which is part of the City University of New York. And then I came here.
Well, we have history.
We do.
I'm starting off with a pun already, of doing oral history projects that began after I got into public health via the Chicago COVID-19 Response Corps.
Yes.
And then I have been privileged to work with you on some of your long-standing projects, including A Living Women's History of HIV, where you went to Chicago, here in Chicago, then to Brooklyn, and then to North Carolina, not necessarily in that order. I'm not sure if that's the order.
That is the order.
Okay.
Chicago, Brooklyn, North Carolina.
And what I've noticed is there's this through line through a lot of your work around health. And so, but you are not in public health, even though your work is very meaningful to public health. And so on the community level podcast, we often are talking about health topics. And I thought it would be great for us to reach out west to east, so to speak, to find out what's going on the East Campus, all this great health work that people are doing. Some people who even have training in public health, but that are doing this work through a different lens, through a different method. And I also want to talk to you about the long tail of your work, because I've noticed a big issue in public health in that oftentimes our projects are short and they have short lives, and there's not an opportunity to follow up or to check in with the people that were involved, or, you know, continue that dissemination over years. And so that is a big question for me as to like what it's like to have your work live for decades and to stay with it. You know, that's a thing that I think is missing from public health work, that I should say more explicitly public health work, that we could learn some lessons from you on that.
Well, that's a big question. I started working on the history of HIV in 1995, 1994.
That was a good year.
So that's 30 years ago. And part of that came out of, and at the time, you know, I had to prove to my dissertation advisor that it was going to be historical, because of course it wasn't that historical, right? So we now know that HIV was likely endemic in the United States easily in the 1970s and became epidemic in the 1980s. But so I grew up in New York City in the 70s and 80s, and I was in essence going to graduate school to study history at a time when I was proposing writing this dissertation, and AIDS hadn't existed that long. You know, I was looking at a document from a class that I took my last semester at Madison, where I went for my undergrad. It was the summer of 1992. It was a class on lesbian culture, and there was a section on ACT UP. But in 1992, ACT UP was maybe 4 years old. It's also before protease inhibitors, antiretroviral drugs that I started. And so I approached my study of health in the case of HIV/AIDS as somebody who was interested in studying LGBT politics. And so it's coincidental that, not coincidental, but like AIDS became the lens through which I did LGBTQ history. And what's tricky about that is, of course, there's a complicated relationship between the history of HIV/AIDS and LGBTQ history. And they are in a constant kind of, I don't know, not battle, but they take up space at the expense of others without recognizing that, of course, those things are deeply linked to one another. But not just because of gay men, but because of queer sexuality, like the way we have sex, but also drug use, also structural violence. All of these things matter to LGBTQ people.
These are big public health topics now, too.
Huge public health topics. And they were public health topics then also. They weren't yet historical topics. And so it's interesting, like, the way you described it was public health doesn't always know its history. And I think that history doesn't always see public health as historical, particularly if it's contemporaneous, right? So obviously writing about the history of medicine and the history of public health that looks at, you know, like tuberculosis or environmental justice, or I don't know, the history of hospitals, the history of public health, the formation of the New York City Health and Hospitals Corporation, for example, or the study of lead, or whatever it is. There is a way in which there is this sort of long ago history. But what happens, I think, here is that history doesn't see contemporary public health as historical. And public health as a field isn't concerned with history.
Wow, I think that's spot on in a lot of ways. I'm reminded of being told when I was working on a school project that I could not include what I wanted to do as far as like a very brief, like little oral history amongst some people in a community that I was studying, that would ask them questions about, you know, how they felt about particular like prevalence of a certain condition or a certain amount of pollution in their community. It's just to provide context to go with our like quantitative data. And the instructor was like, no, this would be unscientific or it'd be anecdotal, and you weren't trained to do that in this course, so that it wasn't applicable. And I thought that was like a really clear example of that, of like, it's just not our process in public health typically to include any sort of oral history in the work. We have qualitative methods, and we have interviews and focus groups and many tools, photo voice, but we're not quite on that level, I feel like, when it comes to considering what people are feeling in that moment when things are happening. And this work is not just for HIV, but also for the COVID work you've done. I feel like it's very important, because that was how we started, was with the COVID work when we did our Care and Conversation project, which I'm very, very proud of.
Yeah.
But yeah.
Well, I think part of it is that is also a problem with the current state of university research endeavor or enterprise. Meaning, like, we talk about this thing called qualitative methods, but it does always go back to, what does it mean to do generalizable research? And that is the impetus inside of public health. It is a social science. It is the health sciences. It's where the health sciences and the social sciences meet one another. And it doesn't have space in the same way for the humanities. I mean, then there's this field called health humanities or medical humanities. But I think part of it is we're not able to understand what a full range of research methods might be and what that can do for us. And there are reasons that are far exceed what anyone's intention is, that sort of define what is called research and what isn't.
That was going to be my next question, actually. Like, how do you feel about that? Like, that sometimes your work is not considered research, like, in the sense of like requiring an institutional review board process, even though with oral history there are so many different layers of consent and there's lots of rigor, but it's just doesn't get labeled as research. And so then there's in some sectors I feel like there's lack of respect for work that is not considered research, like whether it's called inquiry or scholarship. Yeah,
absolutely. I mean, that is the that's why I'm not in public health. That's why I do public history. And I think that public health really is grappling. I mean, the other way to ask that question is, what is the function of the word public in the way that we define these research endeavors? So there's one set of questions, which is like, what gets defined as research? And that often means using some kind of scientific method or some kind of positivism or something like that, where of course there's like all of these other methods that are about inquiry and innovation that are distinct from the scientific method. Thinking about textual analysis, thinking about archival research, thinking about visual analysis, thinking about what it means to look sideways at something, what it means to try and, read between the lines, what it means to think about context. These are not understood as parts of the scientific method. And so they're not therefore considered research. But of course they are. They are fundamental to the way we produce knowledge and the way we interpret what we see in the world around us. I think the other question is like, what is the role of public? Because that's actually the other place that my work comes together with public health, is not just that I study things that are about health and wellness and illness, virus or whatever it may be, but it's actually that the public is at the forefront of it. And I guess that's my question back to public health, is like, how is the public part of public health? Because I know what I mean when I say public history, and I know what I mean when I say the work that I do is making the public central in the making of public history. Not just that they're studied, but that they're the agents of it. And I think public health is in a really, I think it's a, There are a lot of different, I mean, there's not one kind of public health, but I
Right.
do think that that's a pretty fundamental question.
No, that's deep. Actually, I'm actually looking forward to talking to people about that more. I've been trying to find ways to challenge public health a little bit, to be a bit braver, especially in the current climate we're in, where it's like many things are under attack. Many of the things that helped keep people alive over the last several years are being either stripped away or made more difficult for people to reach. And so I think part of that problem is the public not being in public health as much. And so them not feeling a part of it, them feeling like it's represents, some external force that is attempting to exert control over the public, as opposed to the public being involved in their own health, right? But yeah, that's a big part of why I wanted to talk to you about this. And another part was trying to find ways to connect the students in the School of Public Health to the East Campus and to other ways in which they could do the work they want to do to reach communities, especially in community health sciences, to find different ways to answer questions, or even to think about questions, or to think about what it means to be a public health practitioner. And so, like, what advice do you have for students to, like, who are interested, who hear this and they're thinking like, wow, I want to get into oral history. Like, I would love to find another way to look at this work.
Yeah. I mean, I think the first thing is, much like you did, like, come here, take some classes here, whether it's for your gen eds or whether it's figure out how to get some of your electives or selectives to be over here.
Right, I was a social justice minor, and that definitely connected me to gender and women's studies. And
so all of the interdisciplinary units which are in LAS have minors. Gender Women's Studies has a GWS minor and social justice minor. Black Studies, Global Asian Studies, and Latin American Latino Studies. I would say the strongest health people, the strongest, I mean, it exists actually in all of them. So you could find a way to grow your commitment to public health in conjunction with those other units by doing a minor. The other thing is, I do think really like taking seriously that the gen eds might be a good way, especially for undergrads, so that you aren't taking all of your gen eds on the west side, but that you actually come over here and take those classes. I think can be really useful. And then the other thing I would say is you have to push your faculty to see the importance of this work. And so I think I think it goes in a bunch of different directions. And then the other thing, then there are other kinds of ways to do it sort of structurally. I'm thinking about Cura. So really taking a class with someone and then starting a relationship with them where you are engaged in a process of learning together, and then think about the kinds of things that might come from that.
Thank you. I'm also
and then also just like, because we're in the Women's Resource and Leadership Center, so really seeing, especially in public health, that the cultural centers, the Centers for Cultural Understanding and Social Change, all of them are places where you belong and you can do co-curricular work, but also just get involved in large-scale projects that are not coming from public health, but really are speaking about the structural determinants of health every day.
Yeah, that's a great example. I'm thinking about Dr. Mario LaMothe's Contagion art exhibit that was in the Black Cultural Center, and that was so powerful for me to witness, and it's very much rooted in health, but also from a Black studies and an anthropological lens, and which is another different area, like you said, over here on the East Campus. And of course the cultural centers are incredible spaces, and they're all on the East Campus, I think. Well,
there's the Ode Center in the Library of the Health Sciences.
That's right. So yeah, the Odette Menon Health Equity space in the Health Sciences Library I don't know. Is it considered technically a cultural center?
Yes.
I guess I didn't realize that. That's fantastic. That it was. That does. I didn't mean to leave it out.
That was a big struggle to get that there.
Yeah.
That public health had a lot to do with.
Yeah, that has been actually a fantastic space for so many great conversations that where I've seen public health and other disciplines blend in that space before that were, just very generative, I thought.
There are a lot of people on campus in a lot of different places, and it's not just students who don't know, like we don't know each other. At one point, I remember I tried to make a list of all of the people who worked on HIV in some way or another.
Wow, that mapping project probably would have taken years.
That's a huge mapping project, and there are people in sociology, there are people in Black studies, there are people, obviously, gender, women's studies, and history, there are people in chemistry, there are people in pharmacy, there are people in public health, there are people in nursing, there are people in medicine, there are people in family medicine, there are people in infectious diseases, there are people in social work, there are people, right? So it's like, this is the thing, is that public health is a field, it's a college, but it's more than that. And part of what I would encourage, and it's easier for me to say than for you all to do, but I would encourage you to think about the things that you're interested in public health and look for people who are doing that work, but in other fields, and not be so, confined to public health.
Yeah,
because that's the best of it, is where it's happening in all of these other places.
It's been a struggle to deal with the siloing.
Yeah.
Even within the School of Public Health, we're separated into divisions, and so it's tough, I think, for people to even find out what work is happening in another division in the same building. So it's obviously a challenge for people to find out what's happening on the other campuses, which is why I think some of the sharing that people do, whether it's on listservs or in any way people are getting out different events that are happening across campuses, is really important. And recently I was at a meeting that was like a listening session for community health sciences students mostly, that was focused on like asking questions about like, how can we share things better? How can we put you in connection with the good work that people are doing in other parts of the university? So I'm glad to see that work is going. I think it's going to be going forever. We'll always be trying to make it better.
Yeah.
I'm thinking even about when you mentioned earlier about the intersection between LGBTQ community and health. And with my time at the health department, I was trying to work with the Syndemic group,
right,
which is their group that is very explicitly focused on LGBTQ health and also STIs and HIVs and HIV itself. And the work they've done, whether it's supporting community events or the films that they created, the Journey Towards Zero film series, which is incredible, which is probably one of the best things I've seen as far as just having people who have the experience, who are living through a health thing that you would like to study, and actually just kind of giving them the keys to the car and saying, hey, I want you to drive this story and help us find out what's going on. That's probably the best thing I saw at the health department, that was that intersection between putting the public in public health.
Yeah.
And so I definitely want to uplift that, and I'm reminding myself to include a link if those are streaming somewhere, because they were like very weird about like, you could only see it in theaters for a while. So, but I need to get that out there. But so I think this has been great. It's been very generative in helping people understand better like what's going on over here on the East Campus and build these connections. And I hope to continue doing this work. I hope to continue working with you for a long time.
We've got a lot of stuff to do together.
For sure.
Still.
Yes. And just thank you so much for making time for this.
I'm excited.
Thank you for tuning into Community Level. If you enjoyed today's episode, please don't forget to subscribe, leave a review, and share it with others. Join us next time as we continue to explore the intersection of research and community action. Until then, stay connected and stay level-headed.